actually don't think I've ever gone live like this before. So hello everyone. Just gonna wait a few minutes for people to jump on and join the live all about pigmentation. All the questions that you want, and we're going to have Kerry here in a few minutes talking all things laser, because I love lasers. I would love to have a very fancy expensive one, but I don't. So Kerry is an expert on lasers, so we're going to talk about lasers, skincare. Oh, here we go. Great, nice on time. Very punctual. Thanks for joining on, everybody. So good to see you all. I actually haven't done this.
Hi.
Oh, here we go.
There I am. Hi, how you doing?
Good. I don't think these AirPods are working. Am I talking on this or not? Oh God, I'm so bad at this.
I can hear you.
Okay, good. Once you can hear me, that's totally fine. So Kerry, you're inside in your clinic there, I take it.
I am. I can't get away with doing these at home because I have a 5-year-old. So, and my Wi-Fi is not that great at home either. So yeah, it's just easier if I come into clinic. And I'm very lucky. I only live 8 minutes from my clinic, so not a long commute.
No, I thought it was pretty good. I'm a 20-minute walk, so it's not too bad. But
Much healthier. 8-minute drive.
Yeah, I'm about the same 8-minute drive, so I'm lucky as well. So, Kerry, why don't you introduce yourself? Because some of my followers might not have heard of you because you're in the UK, and I want them all to know how experienced and amazing you are at lasers.
Oh, thank you. Yeah, so my name is Kerry Belba. I've been doing lasers for nearly 17 years now. So I opened my business in 2005 down in not so sunny Bournemouth, not at the moment, on the south coast in the UK. And I'm also a laser trainer. So I have been a laser trainer for about 12 years now. So I've trained sort of doctors, dermatologists, clinicians, anyone who sort of buys medical grade equipment. And I have like a vast array of different sort of lasers and IPLs that I sort of call my toolbox. And I was recently voted onto the British Medical Laser Association. And very importantly, I'm going to be sort of representing the aesthetic practitioners because the vast majority of laser users in the UK are not actually from a medical background. So they are used very much in aesthetics, obviously, as well as medical disciplines. But yeah, so it's really exciting. So I'm going to be hopefully doing a good job representing all of those people.
Good.
And yeah. And also, yeah, if you could tell us a bit about yourself as well for my viewers.
You can share this to your page as well. So I'm originally a dentist. My name is Jennifer Owens. I'm based in Ireland. I work between Cork and Dublin. And I don't have to do any of the horrible dental stuff anymore. I inject outside the mouth now instead. So I do a lot of injectables, Botox, filler, fat dissolving, mesotherapy, peels, kind of medical grade skincare, and unfortunately I don't have any fancy equipment. The fanciest thing I have is my chair and my fridge, I think. But I am thinking about a Dermalux, having chatted to Kerry, because
Dermalux is amazing.
Yes.
Yeah.
So that will be one thing that I'm looking at, because it does, one thing I am obsessed with, and I was talking to you about this before, we both suffer from melasma, so we're both fairly obsessed with pigmentation. So
yes,
what tonight is all about is pigmentation, and I think it's really, really important at the start to explain that, like, pigmentation, so many people say, oh, I've got pigmentation, I've got this, and pigmentation is just the color. It referring to the skin, so it can be hyperpigmentation, which is darker, or it can be hypopigmentation, which is actually harder to treat. It's pretty impossible to treat once we've lost all the pigment in the skin cells. So really, when you're looking at pigmentation, you're looking at, well, what have I got? Have I got freckles? Have I got sun damage? Is it melasma, which is something that can kind of go across the cheeks and the forehead, and that's what both myself and Kerry fight against for years.
Yeah, the fight against melasma.
It's lifelong, isn't it?
I know. And sometimes people, I don't know about you, but on my website, it comes through, you know, as a web inquiry, and people will select pigmentation. And it is a form of pigmentation, but actually it's what we call PIH, so post-inflammatory hyperpigmentation. Basically, you know, someone's had a spot and it kind of leaves a mark. And again, that's kind of like a, you know, a whole other sort of type of pigmentation that we're dealing with. So yeah, it's a vast topic, isn't it? And everyone can present very differently. So, I mean, I'm always keen to stress, you know, that any kind of pigmentation is an inflammatory response in the skin. And I think when you kind of remember that, it very much sort of focuses the way in which you're going to deal with it. Because obviously when you're dealing with an inflammatory response in the skin, you equally have to be careful about using anything that can cause inflammation in the skin, because obviously it could exacerbate it. So how do you sort of deal with sort of various types of pigmentation? Because I know we kind of use different tools in our toolbox, yes, don't we?
We do totally different things. I suppose part of it is the diagnosis, and that's the one where it's, you know, it's really important to assess what is it that we're dealing with here. You know, have we got some freckles that maybe have gotten worse with sunbeds or sun damage, or is it somebody after acne where we've got marks on their face? Not only because they're slightly different in how they appeared, but also you tend to have different types of skin. You know, you don't want to fling a whole load of vitamin C at this post-acne oily patient to brighten up their PIH or their post-inflammatory hyperpigmentation without a bit of caution.
Yeah.
Whereas if you've somebody in their 50s who's postmenopausal, dry, sun damaged skin, we can actually do a lot more with something like vitamin C, because you can drown them in it, and they're going to love what it does to their skin most of the time. So yeah, I think that for me is really important, and I would imagine it is for you too, because particularly with you know, devices that can. Oh, and Patrick is he's a fabulous makeup artist who suffers from acne from time to time, but he was using vitamin C when I met him, so he said he's still scared of vitamin C.
Yeah, I mean, I think this is the thing, you know, and I think this is why going to somebody, you know, like yourself or myself, you know, who specializes in skincare is so key, because, you know, you can read X, you can read, oh, well, vitamin C is great for this, but actually it may not be good for you because you have Y, and I think that's the danger, you know, that there's so much information out there, but trying to, you know, decipher which is the best option for you without having sort of all the background knowledge, with, you know, the medical sort of information. I think it is quite, you know, you can basically make your skin worse by just thinking, oh, I've heard this, I'll go and buy some of that online. And actually you end up with a worse problem. So and even not even just different ages, you know, you can have two menopausal women, but they can be presenting quite differently. And just because what works for one person doesn't necessarily it's going to mean it's going to work for your friends. So and sometimes I get that, you know, I get people come in and they say, oh, you treated my friend or you treated my cousin, her skin's amazing, I want exactly the same treatment. And it's like, that's great, let's sit down and chat about it, because it might not be exactly the right one for you, but yeah, of course, you know, we can help, but the treatment approaches obviously vary, don't they?
Well, I suppose that's the thing. I mean, obviously at the end of the day, what we're all looking for is lovely, glowy, clear skin. But depending on where we're starting, we're maybe going to be using different things to get that result. And I do think there's a lot of kind of commoditization or minimizing of what some of these treatments are, whether it's a medical grade skincare or, you know, lasers certainly in the wrong hands can do an awful lot of damage. You know, I'm sure given your position with the British Medical Association and training, you've probably come across maybe more than the average laser therapist. Now, you're not the average laser therapist anyway, but
I think as well, because prior to 2010, we were all regulated by the Care Quality Commission, which ironically did not denote that you were a brilliant practitioner. It did mean that you were exceptionally good at actually getting through their registration process. But even then, the one thing that they really sort of failed on, in my opinion, was the issue of training and your you know, qualifications in terms of being an expert at what you do. But at least there was some regulation. But now, obviously, you know, you do need to be careful who you choose, because in the UK, you know, people can buy, you know, I'm writing articles for Aesthetic Medicine magazine at the moment, which is aimed at sort of practitioners rather than Joe public. But obviously anyone can read the articles. And I was saying there, you know, in the September issue, that training is so important, because, you know, there's an influx. People can buy lasers on, you know,
If they've got the
online.
money, they can go buy
You know,
it.
there's like an influx from sort of like Chinese, you know, sort of laser machines. And sometimes, you know, machines literally arrive in the country with like a badly translated user manual from whichever language, you know, whichever country that it's been manufactured in. And yeah, with lasers, you really do need to know what you're doing. But in particular, with pigmentation, just in itself, you need to know, you know, you need to know your pigment. I've had people come in to me before who said, oh, I had a bit of sun damage on my top lip. It just came out after one holiday. I went to a clinic down the road. They said, oh, it's a bit of sun damage. We'll IPL that for you. And of course, it's made it 100 times worse. And that's the thing. You do need to kind of know your pigment. So, and also knowing when to refer. You know, another article I wrote was on benign, you know, the dilemma facing practitioners, you know, regarding benign pigmented lesions, you know, when to treat, when to refer. I mean, obviously you're a doctor, Jennifer, but a lot of practitioners like myself, you know, come from a non-medical background. We are not, even though I can look at, you know, I've been in this long enough to know a freckle when I see one, you know, or if it's, you know, a mole that's not looking too happy, but I cannot and would not diagnose. And it's that, you know, having that ability to know when you can treat without making a diagnosis, but equally knowing when to refer as well. And that is really key when you're dealing with any kind of pigmented lesion. So
it's so important, because you can actually get rid of the pigment and then you have a lesion that's not benign. You know, it is in the realm of skin cancer, and it's much harder for the dermatologist or whoever is dealing with it than to deal with it.
Exactly. Especially because because the things you're told to look out for, you know, this with the A, B, C, D, E of lesions, you know, asymmetry, border, diameter, and all of those things. When you laser any kind of sunspot or freckle or lesion, it does all of that. It changes its color, it changes its shape, it changes its symmetry. So of course, you know, so I'm always keen to stress, you know, lasering a mole, not that we do laser moles, but if you, and in dermatology, they are using lasers now to remove moles and things like that. But in aesthetics, someone like myself from a non-medical background, we wouldn't laser over a mole. But if we were to do that, it's not going to make it cancerous. It's not going to cause any problems. It's just that your reference points of looking out for changes in your moles, like border, color, asymmetry, are all going to change if you were to laser it. And that's why I'm always keen to say, you know, when I am training other practitioners, you know, we do not go over moles, because people will have nothing to go by if there are any changes in that mole. So yeah.
That's a big one. I mean, that is a big one that a lot of people wouldn't know, popping into a big chain clinic that has lasers and they say they have the latest and greatest. Do they have someone who's actually trained to the standard that laser deserves, with its big shiny name or whatever it is? So that's a really good point. What would be your, I suppose, your favorite type of laser, and the kind of treatment that you do most with that laser?
So if we're talking about pigment, pigmentation.
If there is, because I know with lasers, you know, they are energy-based devices, and that is one thing. I don't have any of these devices, but any energy-based device, we do have to be careful with pigment, because you can cause inflammation. There's heat, you know, there's trauma to certain cells, which is in a controlled way for certain results. But when it's pigment, you do have to be careful. So are there treatments that you do for pigment with the lasers? And so what one do you use? What would people be looking for?
So I when it comes to lasers and IPLs, so that's intense pulse light machines, I only use those light laser or IPL devices for things like sunspots, and they're sometimes called liver spots, age spots. They're basically solar.
Lovely names.
Exactly. We call them solar lentigo. So they're basically sunspots. And I only use my lasers or IPLs for that. When it comes to melasma, or cloasma as it's sometimes called when people have it when they're pregnant, and I get that myself, and obviously you mentioned you do too, I only use LED. I do not touch people with a barge pole if they have melasma. Now, I do know some clinics who do, and I have seen some photographs and before and afters of people who've used an IPL on melasma, and they have managed to lighten it. But first of all, you are playing a bit of sort of pigmentation roulette, because it's interesting. So I have seen some before and after pictures, and I would say they've been very lucky, but also 50% of the time it's going to come back anyway, even if they do the right
PIH, so they can get post-inflammatory hyperpigmentation.
Exactly.
Even though they maybe dealt with the melasma. I don't think melasma ever goes away. I mean, we were talking one time about how you have to be, what was it, a sun-hating vampire?
Yes. A day-release vampire lurking in the shadows with big hats. So that's me in the summer. So, I mean,
it's not just me, guys. It's not just me. There are other people out there as well, obsessed with sunscreen and hats and everything.
Yeah. I mean, I'm half Greek, so back like 27 years ago, when I used to go in the sun, I'm going to be 48 this June. I go really good color. It's not that I can't tan, but I will literally cross the road to walk in the shade. And it sounds crazy because I love sunshine, but I love it from sitting in the shade, because even when I used to try and tan, I never used to enjoy the process of trying to get brown. I used to do it on a mission, to get brown. But I used to hate it. I used to feel like I was roasting. But obviously, with the business that I'm in now, I spend my days reversing sun damage. So yeah, I avoid the sun. But yeah, going back to your question. So I think it's really important here, because although some clinics, I have seen the odd sort of before and after photo treating melasma with an IPL, I would say it's very, very, as I say, it's a bit like playing pigmentation roulette. I would not do it under any circumstances. I have also heard of other clinics say that they've not tried to treat the melasma as such, but as part of their skin rejuvenation, they have used lasers on people who happen to have melasma.
Okay.
And seem to have got away with it. But again, the thing I would like to impress upon people is that you are dealing with an inflammatory response in the skin. And you're using a heat device. So it's like trying to fight fire with fire. So personally, I don't recommend it. If you want to deal with melasma, I recommend sort of glycolic peels and Dermalux. So LED phototherapy is amazing. And it's the only thing I do for my sort of skin rejuve. I've not yet sort of had Botox or fillers. Talk to me again when I'm in my 50s. I'm not far off now. But
you're looking pretty good, Kerry. I've had all this.
Well, as I say, I'm going to be 48 in June, so that may well change for my 50th or something. But the only skin rejuvenation I do for myself is using exceptionally good products, but also having peels and going under the Dermalux, and that, coupled with never going in the sun, is how I've managed to sort of melasma. And I used to have a splodge here. It literally looked like someone had thrown paint at my forehead. It was kind of like here. I've had
the same. I think just the shape my forehead is, the light hits here, which just makes it really handy, because I just have to have a nice good sunscreen or moisturizer on it. It'll reflect back.
So someone's actually just asked, what is melasma? Yes. So melasma is a hormonal type of pigmentation. So it is caused by sort of hormonal changes in the skin, but is exacerbated by the sun. So it could be sort of latent in the skin, and then you go on holiday and it can suddenly sort of start appearing. Some women get it when they're pregnant, but I've seen, I've had guys in, with really tricky melasma to treat as well. It's not just women who get melasma. But it is very hormonally driven. So sometimes women start getting it when they go on the pill. Some people get it when they're pregnant. But yeah, it's basically.
That's the trouble, is that people who don't go on the pill or don't have kids or are men and don't have fluctuating estrogen to quite the same degree don't get it. So we know it's partially hormone, or can be irritated or flared by hormones. But I think excess sebum, heat, I've read about hair dryers, you know, causing problems. If your favorite hobby is hot yoga, I would say you could end up, you know, just the heat of the skin. So that somebody asked there, do you need to apply SPF 50 more than once a day? And yes, I would think Kerry probably agrees with me, especially with her day release vampire routine. 100%. I would be applying it every between 3 and 6 hours with the Synergy 6, because there's one sunscreen I use, Kerry, that I don't know if you've heard of it, because it gives up to 6 hours protection.
Okay, what's the name of that?
It's Intradermology is the brand, so it's a new British brand. But there's some really impressive products. They don't have a huge range, they're quite new. But their sunscreen is very anti-inflammatory, has a very slight peachy tint, so you can see where you put it, but also makes you look a little bit more alive when you put it on. But it's really good. I found it really good for rosacea patients, for you know, I mean, if you're looking at inflammation contributing to melasma, there may be some degree of even chemical sunscreens contribute to that, because that can be inflammatory in certain skin types. I generally don't recommend them for anyone who's prone to acne or sensitive skin. So having something with a physical sunscreen in it is generally how I would be looking at it. And I think anyone prone to that pigmentation, whether it's melasma, which is usually kind of the cheeks and the forehead, marks after acne, you tend to see if your sunscreen is working fairly quickly, because it just flares up straight away.
Definitely. And also, I think, you know, as I've mentioned before, for me, even though you can't see my melasma anymore because of the treatments I do, and I get under my Dermalox all the time, if I was to go, even with my factor 50 that I wear, if I was to go outside without a hat, within 10 minutes, you know, the pigmentation would start, because, you know, a factor 30 will cut out sort of 97 to 98% of the rays. A 50 won't cut out any more, but it prolongs your burn time. But even that sort of 2 to 3% of rays, for some people, is enough to stimulate those melanocytes, so the cells that produce melanin. And, you know, it just undoes all those sort of months of work that you've done. So I literally, my skin hasn't seen, I haven't put my face in the sun for over 17 years now, since I sort of got into this. But, you know, I'm half Greek. I had a lot of sun in the 70s. I grew up in the 70s in Greece with no sunscreen at all. In fact, we used to have like coconut oil, you know, just to really cook yourself. And and God, you know, when I was 21, I mean, I cringe now. I remember being out in the Caribbean. I'd been there like for 5 weeks. I was already like black, you know, I go so dark. And I lay there on the last day with olive oil on my face. You know, it's just, we've all done it. But and this is what I say to clients, that quite often what you're seeing now presenting in your skin is often from damage you did about 15 years ago. Anything up to, you know, it's all there. And when you look under sort of like a skin scanner or something like that, you, even though you can't see it visibly on your skin, you can often see the damage that is latent. And if you don't apply your SPF, that is going to become more visible more quickly as well. So
no, it definitely does. It's a tough one. I kind of liken it to a chronic medical disorder. Like if someone's a diabetic, they're a diabetic, even if it's well controlled, or you know, if someone is an alcoholic, they can be an alcoholic who hasn't drank in 40 years, but you don't really want to test them with that drink. And I do think that the melasma, or that, you know, we talk about melasma and some people don't know what that is. They just call it their pigmentation, or the brown areas on their face, their uneven skin tone. That's just going to flare if you expose it to something that stimulates those melanocytes, whether that's heat, you know, sun, trauma, so things like microdermabrasion. I certainly run quite a bit, particularly in lockdown because there's nothing else to do. And at one stage I was wearing a hat, but I remember wearing quite a tight hat and actually having marks here, and the heat and the friction of that. So it's kind of working out what works best for you, where you're minimizing all of those factors. But remembering that sunscreen is not like an invisible blanket. Like it doesn't protect you. The sun can still see you.
Absolutely.
It just protects your skin from skin cancer for longer than if you had no sunscreen on.
And I think it's really unhelpful, actually. You know, often, you know, at certain times of the year, the press will come out and say, you know, we're all so vitamin D deficient and you need to get those rays. And what I always say to clients is, yes, we do need a certain amount of course we need sunlight, but it doesn't have to be on the face. You know, you can expose your arms during the sort of safe periods of, you know, time of the day when UV isn't at its strongest to get your vitamin D. It doesn't mean that you have to, you know, have that exposure on the face.
Well, the thing is too, I mean, you know, if you go out in shorts and a t-shirt, you've way more like topical area to be getting these UV rays to produce vitamin D. You don't actually have to put it on your face. Or I do find that the décolletage gets destroyed in people, even because I have, since I can remember, my mother has always made me cover my face in the sun, like always, factor 50 and a towel, which probably didn't help my poor acne skin when I was really congestion prone. But I have noticed from here, you know, you wear a peaked hat or you wear a hat, it doesn't protect your chest, and that's such fine skin. Where something like the Dermalux is brilliant because you can just, you know, pop it over there. So, like, you know, we obviously treat things differently because we have different tools at our disposal, and melasma would be a big no-no for laser. So we can chat a little bit about products and things that both of us do to control our pigment.
If someone comes into you, obviously you don't have lasers, and someone had, you know, melasma, how do you go about treating that?
I suppose it depends on the person. There's a number of ways we can go hard. You know, hydroquinone and tretinoin and some exfoliation generally are the gold standard of treating pigment, because when we're treating that melasma, that hyperpigmentation, whatever it is, we want to try and shift the old skin cells. So that's what we're doing with your glycolic peels. We're stimulating new skin cells, and retinoids can be useful in that, and they can help exfoliate and get some of the things to penetrate. And then I think one of the key things is to block the pigment transmission and stop those melanocytes, which you can stop the stimulation, but sometimes there's still pigment just drifting through. And something like hydroquinone is a pigment blocker. Now, there are lots of pigment blockers, antioxidants, brighteners, a lot of kind of tyrosine inhibitors out there. For me, it depends on the person. So some people want as natural as possible. They don't want anything toxic. Other people, you know, feel like they can't leave their house because there's such bad pigment. So I will throw the kitchen sink at that to just get rid of it. Like, you know, you do start to see, I mean, if you've treated melasma on yourself, Kerry, you've seen how quickly something like a hydroquinone or something like that can knock out that pigment. It's not a long-term option.
No, so I did a course of hydroquinone years ago under a dermatologist, and I did find it made my skin extremely red and flaky. But what they didn't tell me is that I started sprouting like centimetre long hairs from my cheekbones, and it's not a really common side effect, but after a bit of digging I did discover that it can distort hair follicles. And then of course the irony is I couldn't then have laser because it's over melasma. So luckily they kind of disappeared after sort of 18 months.
Well, I would say they must stimulate it, but then they must go away if you stop.
Yeah, exactly. So it did go, and yes, it did definitely help. But I think I've known other people have responded much better. I think I was unlucky. And for some people, hydroquinone is the absolute answer to melasma.
I've seen good results. I got very good initial results. I suppose what I don't like about the hydroquinone is, number one, you really shouldn't be using it long term. You know, you can get ochronosis, you can get grayish of the skin, and you don't actually tend to look good. I think when people are focused on that pigment, you do look like the day release vampire, but who's like really unwell as well. Like, you know, it's like this white translucent grey tone to the skin. Yes, it's even, but it's not nice. We're all looking for, I mean, Jesus, most girls in Ireland are looking for a bit of colour in their face more than more than anything else. It's when you put on fake tan on your face or whatever it is, and you just have like, it clings to all the darker patches, so it makes it worse. Antioxidants would probably be my mainstay now. If I do a course of hydroquinone when we need it, you know, someone's getting married, we just need to sort this problem for now, and then, you know, deal with rebound or deal with tapering off it further down the line. The Cispera Cream, because I was talking to you about that before. The Cispera Cream, I'm very impressed with. Now, I need to go, and I can't find that much literature on it because it's quite new. But
it's Swiss made, isn't it? It's made in Switzerland. I'm always a fan of anything made in Switzerland. My brothers live in Switzerland. They were just,
aren't they? They're good.
They're brilliant at making stuff like that. Yeah, definitely.
Yeah, they're good. Now, and they always look so medical, like in their their packaging as well. So I'm quite impressed with that. But I think using antioxidants is definitely the way to go, and that's not just vitamin C, which is, you know, the most widely known one. Peptides to target pigmentation can be great as well. What do you currently use aside from your sunscreen and your hats?
So in terms of melasma, it's 100% the Dermalux machine. It is just phenomenal, and the nice thing is it's not just treating unwanted pigment. It is boosting collagen. It's for hydration, fine lines and wrinkles. So then anything that I am recommending to apply just gets absorbed that much better into the skin anyway. So my favorite range of products is Jan Marini, which is like an American.
Yes. You love
and
that.
They have, so personally I use something called Luminate, which is there's Luminate and then Luminate MD, which has got 0.3% and then 0.75% of retinol in it as well. But I love that, and when I combine sort of coarser peels, light-based treatment, and that product, I get really nice results. I am very careful with retinol because I think, you know, in higher concentrations, which obviously as a non-medical I can't prescribe anyway, it can sort of aggravate melasma as well. And that's again why I say, you know, don't buy things off the internet. You need tailored consultation to your skin. You know, you can make things so much worse. Equally, you can buy stuff that's rubbish. I had a client who said to me that she'd bought 2% retinol online. And I was like, I could feel my blood going cold. You know, I was like, oh, right. And so how was your skin? She's like, oh, yeah, no side effects. I was thinking, that's not 2% retinol.
No, that is somebody crafting the marketing and what's written on it to be like, we have a 2% retinol. And there is that crazy thing of like, with retinol, it's like this competitive climb to the top. Like, can I get up higher? Because the retinoids, which would be the definite prescription ones, like the tretinoin, I treat those like hydroquinone. You should be on those for 3 to 5 months. Yeah. Except in exceptional circumstances, because your skin does not adapt to it. No. So you have long-term inflammation and you have chronic inflammation that is totally defeating the purpose of trying to, you know, calm the skin down and not stimulate those melanocytes. Because I would use just a range of antioxidants and sunscreen at the moment. Now I have to be so careful. I think with peels, even you can get that pigment going a bit darker for a few days after a peel. So people do have to be quite careful with acids over the counter. You can overdo it with acid. You can make your skin sensitized. And once again, like I would say, a lot of the over-the-counter products, and that's where I'd be really curious to see which hydroquinone even that you had, even though it was prescription. A lot of them will sit on the surface. Yeah. And I have used ones that I got, say, in the States over the counter, where you can get like way more stuff to do damage to.
Buy anything in America.
I remember using a brightening serum that had 2% hydroquinone, and it turned, because I get pigment in one of my glabellar lines, which is really bloody annoying because I can Botox the hell out of it and it still looks like this. There's a line there. But it just turned it red. It was like, okay, it's brown, but I don't know that red is an improvement on this.
No, exactly.
You know? I know. So you do have to be so careful. Okay, so Kerry, if someone was looking, you know, they're using their skincare, but they've got a couple of what they think are age spots.
Yeah.
How would you go about it? I mean, you like that's something that not that I have a problem with, but people often will inquire and be like, hi, I'd like 3 hours of Botox and 1 ml lip filler. I'm like, well, what's your problem? Like, what is it that you're worried about? What can you do for that? So if somebody is like, okay, I think I've age spots, I listened to this girl, Kerry, who knows her stuff.
Yeah.
I think I've got age spots. What would you advise them to start with?
So 100% laser or IPL, and I actually would not advise trying to lighten them with anything, because when it comes to laser, the darker the target is, the more light it absorbs. So actually, the darker people's sunspots are, the easier they are to treat, you know, because they just absorb so much light. It's a bit like if you imagine going out on a hot sunny day wearing a white t-shirt, and you've got one round sort of yellow circle and one black circle. If you put your hand on the black circle, it's going to feel hotter. And that's because dark colors absorb light and heat up. It's the same, you know, if you wear a black t-shirt walking down the beach, you're going to get really hot. If you wear a beige t-shirt, maybe not so much. It's the same with sunspots on your skin. So the darker they are, the more light they absorb, and the more light they absorb, the better the results, you know. So it can be tricky treating very pale sunspots. So what you don't want to be doing is using any kind of lotion or potion that is promising to lighten these sunspots. So yeah, just leave those alone, come in and literally laser or IPL them.
Now, someone has just asked there, could IPL in turn make pigment worse? Now, obviously, if it was melasma or something.
If it was melasma, yes.
Definitely.
So if someone,
the person didn't maybe know what they were doing with the machine, perhaps.
And this is the thing. So if someone comes to me and they are literally got, you know, a few sunspots, and I can see a patch of melasma, even though it's not in the treatment area, it's a complete contraindication for me. I'm like, I'm really sorry, you know, it's not something, you know, we can treat. But if someone doesn't present with any melasma and they've got sunspots, you know, I really grill them. You know, I'm like, are you sure, you know, maybe a summer ago, did you notice any kind of irregular pigmentation? Because it may have disappeared, but if I laser them, it will come out.
Yes.
And that's the thing, you know, the only time I have lasered people for sunspots is people who say to me, oh gosh, you know, I was pregnant 10 years ago. Whilst pregnant, I had chloasma or melasma, and I've been on summer holidays since. It's never come, you know, repeated again. So yeah, for them, I would, after having thoroughly sort of explained, you know, the possibility of pigmentation coming.
There's a risk with any device like
there
that.
Is a risk, yeah.
It's lower if you go to somebody who's been using it for years and years and has better instincts, better training, better experience. And
also a practitioner who is willing to turn you away. That is the thing, you know. I have been known to turn away clients, you know, for various reasons over the years, because if it's not in their best interest, what I do not want is to take someone's money, laser them, and then they end up with a problem. You know, we're supposed to be problem fixers, not problem creators. Now, with the best will in the world, you can't always, you know, rule out any sort of possible side effects, but you have to go into it knowing that, you know, to the best of all intentions, that you're not going to make something worse. And so, you know, I have occasionally, so sometimes, you know, when I get ladies, you know, through the menopause who are getting, you know, really sort of thick, androgynous, very male-like, you know, testosterone driven hair here, but they've got melasma here, I thoroughly explain. I say, listen, you know, if the hair bothers you more than potentially getting the same pigment that you're getting here under here, then fine, you know, you can sign to say I've thoroughly explained the risk and we can go ahead with treatment. But they have to really convince me of the case. And if they're kind of like, well, I don't like the hair, but I don't really want to get any more of this pigment, it's an absolute no. You know, there's no way.
You had a different problem. At least they were used to their existing problem, and you had nothing to do with it. So.
Yeah, exactly. But also, it's, you know, say to me, look, God, I could not care less about pigment, but I cannot live with this hair. Then they are a good candidate for that, you know. But it's almost like they've got to convince me that the pigment doesn't bother them and the hair is really the bane of their life. And then obviously, being down here, it's unlikely they're going to get melasma there anyway. Melasma really does affect foreheads. It has a butterfly effect.
Yeah, you can really see, like I have people where they nearly look like they've black eyes. Like it really can be quite you know, deforming in that sense.
Yeah,
Um,
definitely.
oh, okay.
Someone asked before, would you recommend microneedling to get products into the skin? Personally, if you were under a doctor like Jennifer, and she was very experienced, possibly. Personally, for me, microneedling causes trauma and inflammation to the skin. That's not to say you can never do it, but it's not. And again, you know, I always say to practitioners, don't do anything beyond what you feel comfortable, because I have melasma myself, and I have kind of like a view of melasma because I have it myself. I wouldn't want to put a microneedle on my own skin, and therefore if I'm not prepared to do it to my skin, I'm not going to do it for a client. But it's not to say you can never do that. So what would you say to that, Jennifer?
I would say there are different types of microneedling. You know, I use the skin pen, which is the FDA approved one. That's really, really hygienic. That's kind of why I chose it, because there's no cross infection. But for that, I primarily use that for scarring, for pores, for collagen stimulation. It is kind of traumatic. Now, it's not massively, but I have certainly have people who come in and they kind of say, oh no, I had microneedling once. I had bruises and track marks all over my face for days. Like, no in hell, don't put that near anyone who gets melasma. Like 100%. I would probably lean, you know, it depends on what all the issues are. If they have huge pores, I do love some microneedling, but I would probably look at something far less invasive, like a stamper, like the Wow Fusion or the Aqua, what's the one, Aqua Gold, where it's much lighter and you can put brightening things into it. It wouldn't be my first treatment.
No, I think also that the ones that stamp are so much better, because when you're rollering, it's dragging the needles, and definitely.
Yeah, so the pen is a motorized one that goes up and down and you slide it along. I don't use rollers anymore, and certainly those home rollers, anyone who has melasma or is prone to that uneven pigment, I wouldn't be touching it.
I wouldn't recommend.
No, I would go through a few sessions of Dermalox to improve your product absorption. Before I would be saying, needle it in every night.
I unless it's under supervision, I wouldn't recommend needling at home, you know, unless it's, you know, being given to you by someone like you. This is how to use it. You use it once it's and but God, please don't buy stuff on Amazon and start microneedling your face. But
oh, there was another question there. Yeah, it was like, how can you tell if it's melasma? Is it purely pregnancy? No, it's not. Now, pregnancy can spark it, but I feel like pregnancy just uncovers it. Like,
well, do you know, I had melasma, so I'm going to be 48 in June, and it started when I was 27, and I didn't have my daughter Zara until I was 43. Now, I had melasma way before I was pregnant, and when I felt pregnant, I thought, oh God, I'm going to literally end up like looking one pigmented blob now. And you know, it did not. And obviously by that time I had it under control anyway. So
you were using your Dermalox and you were wearing your sunscreen.
Nothing.
Because there's not much you can do for someone when they are pregnant. You can't be giving them hydroquinone or retinols or anything like that.
No.
It's sunscreen and your hat and a Dermalox.
Exactly. Yeah, it tends to be that for most people, if they get it for the first time ever whilst pregnant, it tends to go away afterwards. Not always, but I found with my clients it often resolves itself. Whereas I had melasma for years before I was pregnant. It wasn't, ironically, it wasn't exacerbated by pregnancy. And
lucky you.
So it's just so weird. It's never the same for everyone. But
we just don't fully understand it. There's so many layers of pigment being created and inflammation being created in the skin. Even environmental pollutants and the size of some of those now, they are talking about that. It's inflaming the skin and contributing to pigmentation. And I do believe that is a kind of growing problem.
And it's also really interesting what, you know, everything that's going on at the moment, talking about the microbiome, you know, in the gut. Affecting, you know, sending sort of messenger signals to the skin and things happening on the skin as well. So, but yeah, I mean, we're going a little bit off track, but I would say to anyone generally, you know, if you are dealing with patches or areas of pigmentation, I personally would not laser that or IPL it at all. I would go under LED phototherapy like Dermalux and with some peels, and don't try and treat it at home because you can make it so much worse. If it is sunspots, then I would use an IPL or a laser. And someone's actually mentioned here, I had treatment for sunspots with the ruby. It had no effect. I have to say, I am really surprised. I only get my ruby out when the sunspots are really pale because it does such a phenomenal job. But again, I don't know which ruby laser was used. It may be that they were just really too pale to start with, but if they weren't, I mean, I'm gobsmacked. I can't believe a ruby wouldn't pick that up. So you're welcome to DM me afterwards if you want to. This is the wall, and I can try and help you. But yeah, I'm really surprised. So normally I would go for IPL or ruby for sunspots. So, and then obviously with products. So what about you, Jennifer? What would be your kind of go-to parting sort of comments for?
I think melasma, I think we don't know enough about it. I think there's more and more coming out all the time, and I think there may be more evidence coming out that like anything that inflames your body,
yeah, absolutely,
can cause this, whether it's loads of sugar, stress,
gluten, yeah,
whatever it is that makes somebody inflamed. I certainly have found, since I've cleaned up my diet, I'm using loads of antioxidants, I'm taking in more antioxidants, my pigment is not as much of a problem. Now it wasn't really tested last summer because nobody got to go anywhere sunny. And even at the start of lockdown, when I was in lockdown number 1, when I was doing virtual consultations, I was facing a window with my laptop because I had this lovely light and I looked great in my consultations, and I could start to see it creep up. So definitely that sun avoidance, but kind of assessing all of those things for me has been really important, like ditching the hat that was causing friction when I was running, and hot and sweaty and heat being generated just seems to be worse than running in Ireland. Now, if I was in Australia or South Florida, it might be slightly different. For me, I think it's actually improved as I rein back from some of the stronger products. So I've used the Obagi Nuderm system, which was transformative. That is kind of still my go-to.
Is that the medical range?
Yes. Yeah. So that's Obagi. They would have the Tresh, the hydroquinone. You're using a couple of different exfoliators. You're flaking and peeling. Like, I remember my boyfriend being like, your neck is just like flaking up. I was like, shut up, it's fine. I'm going to be
decomposing.
Yeah, like, it's coming off. It's not a fun process. It's not for everybody. It's my job, so obviously I'm going to do it. But it was transformative, and I have a number of patients that did follow me down that path, and it is great. It is not a long-term option though, and I find it gets me the quickest results. Like when I just we need results now because this person is really depressed about their skin or whatever else, and they've oil issues, they've other issues. For me, since then, I've used a lot of different antioxidant serums. Illumier Everactive C&E is one of my favorites. The Obagi 10% Professional C Serum. Cispera now, the Cysteamine Cream, is one that
I'm really excited about that, actually.
That I'm really impressed. The other one that was quite good, that was non-hydroquinone, was the Skin Better, which is an American brand that are kind of coming into the UK. Same ethos as Illumier and pH Formula, where it's very much about, and Janrini would be similar. It's not hardcore. It's not like let's strip the face off you. Like Obagi is fabulous, but their Nuderm program is intense. Not everyone is going to do that. So I have moved more towards those antioxidants, and I have as an ongoing thing.
There's also a very exciting, I think it's because I'm just starting to look into it. I think, is it called Mesoteric or something?
Mesoaesthetic, yes.
Yeah, Mesoaesthetic, and it's completely gone out of my head. But yeah, that's kind of like an 8. And this is another thing, when you're doing pigmentation, you're really looking at a sort of 8 or 9 month sort of, you know, treatment plan, depending obviously, you know, as you said, if you're throwing the kitchen sink at it, so, you know, it might
you'll get results
quicker.
in 12 weeks with something like that, but
yeah.
it's going to be a wild ride.
Yeah. And also, just going back to what you're saying about sitting in front of a window, you bring up a really good point actually, because, you know, UVB cannot go through glass, but UVA does. And, you know, sitting behind, people sometimes say, oh, well, I don't go out, you know, well, are you in your car? Because, you know, the rays will go through glass. So, and UVA, as we know, you know, that is the ray that's going to go deep into the dermis. It eats your collagen, it gives you lines of wrinkles, can cause skin cancer as well, and is really not great for pigmentation either.
Well, that's what I like. I know it doesn't stand for it, but I call them UV aging and UV burning, because the B is the burning and the A is aging. It's easy to remember then. Yeah. But it's also to remind people that the SPF rating is for UVB. Yeah. They don't test the UVA. I presume they haven't figured out how to do it. And the UV index, when they say, oh, the UV index is low, that's once again the UVB. That's the one that you put on your body when you're in Spain or in the summer. Yeah. But the UVA, and that's the one where you really see the difference if someone drives a lot, that the side that's exposed to the sun, I mean, I'm sure that's where you see the sunspots. They're bigger, there's more, absolutely. They might only be on one side.
Yeah, and also, I mean, I remember I had a client years ago, and she had, I'm trying to think which way now, yeah, she had the sunspots on her left side of her face. And I said, oh, that's really funny. I said, because, you know, it's nearly always on the right, because, you know, when we're driving. And she was like, I lived in Canada for 30 years. And so I was like, of course, because she was driving on the other side of the road. I was like, oh, that's, you know, that's why. But the thing about UVA, you know, I always say to people is that people only think about applying sunscreen in the summer, but actually UVA is the same strength all year round. It bypasses your melanocytes. It doesn't, you know, stimulate them to give you a tan, but it's incredibly damaging to the skin. It can, in some circumstances, a bit like, you know, when you go on a ski holiday, when they're very intensified, yes, of course, they can. But generally speaking, you know, living in the UK or in Ireland, you are going to be exposed to UVA all year. And actually, I read somewhere years ago that 90% of all the damage on our face from UV occurs between September and May, obviously in the northern hemisphere. Wow. Not during the summer, because the UVAs go so deep into the dermis. You know, it's a longer wavelength, so they are, you know, they go. And
you're more unprotected in those months. Oh my God, that's a statistic. I'm going to write that down, and I'm going to start viewing it.
90%. And it's the same.
You have to wear sunscreen all the time. And I'm like, yes, you do.
And do you remember, did you see that picture of that trucker?
Yes.
So he was not someone who used to lie in the sun trying to get a tan. This was 28 years of driving a truck with UVA coming in through glass. So so I used to say, when I, you know, years ago when I was doing my consultation, I'd say, if you had an identical twin and one of you had sunscreen and one of you didn't, now I'm like, right, check this trucker out. This is what UVA does. So and
then we've all new things like pollution, indoor pollution, blue light. I just put on my
you were telling me about the glasses earlier on.
Yes, the blue light glasses, they're great.
Definitely. But does anyone have any questions just before we sort of
coming up to our hour, and I need to figure out how to save this one. Does anyone know how to save it? Because I know it like prompts you to after an hour.
Yeah, so when you end it, it will say save to IGTV, and then you'll be able to do it. I might cut this bit out.
But great. So guys,
anyway, it's been great to chat to you.
You know, you can DM me or Kerry, or you can put a comment in. We're both going to be posting this to our pages so that you can have a look at it, and we will win the war on pigmentation between us all.
The takeaways are: go to a skin specialist. Do not self-medicate from online, because no matter what you read, it might not be right for your skin. It could make everything 10 times worse. And if it's sunspots, laser or IPL. If it's hormonal pigment, skincare specialist, treatment products, and or LED so like Dermalux.
Yeah. Oh, we've got 2 last minute questions there. How do you treat very light pigment? So that was the ruby laser, wasn't it?
If it's sunspots, then yes, a ruby laser. If it is general sort of pigmentation, I would go under an LED.
Oh, LED.
Can sunspots change to melasma? No, they are 2 completely different things. Okay.
But you could treat a sunspot and you could uncover some melasma.
Yeah.
That somebody has.
Exactly. That's the thing. So go to a specialist.
Yeah, I know.
I'd love to chat to you.
It was great,
Jennifer. Yeah, I will speak to you soon.
Speak to you soon, of course. Bye.
Take care. Bye, guys. Bye.